All right. Well, good morning, everybody. I hope y'all had a good workout. I'm Rebecca Fallon. I am one of the psychologists with the cardiac rehab program for Atrium. So I'm going to do some education for you guys this morning. Usually the stuff that I talk to patients about is related to kind of the stress management part of the program, addressing the emotional struggles that patients often go through after any kind of heart illness. Not always, but it is actually pretty common. And one thing we know is that heart disease affects a family. It does not just affect a patient by themselves. And so today we're going to talk about communicating with your support system. Now, we know that having good social support is what we call a protective factor in heart disease, which means patients who have at least one very supportive relationship or one person that, we call it your 3 a.m. call, someone you could call in the middle of the night if you needed help with something. Patients who have at least one person that they can identify like that tend to have better recovery and better health outcomes than patients who are very isolated and say that they actually don't have any supportive relationships. So it is an important thing. That's why with cardiac rehab, one of the biggest benefits is also the socialization that you get, kind of being around people who really understand what you're going through. Now, when I say support system, I want you to keep in mind, I'm not just talking about your spouse or your family. This includes friends. This might include people from church, people at your workplace. It includes your healthcare team. Everyone at cardiac rehab is part of your support system, your physicians and nurses. So those are all the people who are involved as your support system. And what's important is to understand how to let your support system know what kinds of support and help you need at different points in your recovery. So, for example, in the beginning, one thing that a lot of patients really do need is more information about what exactly happened with their heart. A lot of distress arises from confusion or not really understanding. Sometimes patients will tell me, I had a bypass surgery, but I don't really understand why I had to have that and not just get stents like my brother got stents. Or why am I on this medicine and not that medicine? Or why can I eat this but not that? And so I encourage you to really utilize the health professionals who are part of your support system to get all the information that you need to really understand for you individually what's going on with your heart and what the treatment plan is. Because a lot of times having a good understanding helps get rid of some of that anxiety. Then when we talk about dealing with the emotional part of what y'all are going through, sometimes the support you need is just a place to kind of vent and talk about your emotions. That's why we include stress management counseling as part of cardiac rehab. That's why a lot of patients after any kind of heart event will choose to start seeing a therapist or a counselor or continue with a therapist if they already have one, because sometimes we just need a place to talk about it. We don't want anyone to fix it or tell us what to do differently. It's just nice to have somebody listen to what we're going through. And then when you're communicating with those closest to you, it really is important to kind of let them know, here are the ways that you can support me that feel really good and that help me. And then here are the things you do that aren't that great. And that's why I have those two columns at the bottom of your sheet, please do and please don't. I hear this a lot from patients that they wish their family would be more encouraging, maybe give them more praise instead of doing so much nagging is a word I hear a lot. Or sometimes patients say, I know that my family is well-intended and it all comes from a place of love, but they're treating me like a kid. They won't let me do anything for myself. Or my wife is asking me 30 times a day how I'm feeling and if I took my medicine. And I know she's scared and worried about me, but it's starting to feel kind of overwhelming. So that's an important thing to remember. Certainly your family, the people who love you, they are scared. And what they feel is probably a big loss of control. They don't know how to help. They don't know exactly what to do. And so when we feel a loss of control, we kind of look for anything to grab onto that we can control, which might mean feeling like we need to ask you 30 times a day how you're feeling. So usually that tends to get better with time. Cardiac rehab certainly helps people gain a lot of confidence, and then their family in turn usually gains confidence that, everything's going to be okay. We can relax a little bit. The other thing to keep in mind is sometimes what you need is just encouragement. I had a patient yesterday actually who was telling me he's really, really trying to quit smoking since his heart attack. And he said, I haven't completely quit. I have cut back significantly. And my family makes me feel so ashamed that I haven't completely quit. And I wish they would stop acting like it should be easy for me to do, because the truth is it's really, really hard. And it just discourages me when they point out what I'm doing wrong instead of pointing out all the progress that I've made. And I really would like it if they would just be more encouraging and point out how much better I've gotten about the smoking, instead of making me feel bad that I haven't completely quit yet. So sometimes families need a little bit of guidance in learning how to support you, what feels good and encouraging and what doesn't. And then finally, what you may need from your support system is simply help to get things done, logistic help. A lot of patients tell me, I can't cut my grass, I can't make my yard look the way I want it to look. I've had to have some people help me do that. Or, if you had bypass surgery and you have a scar that's healing, a lot of times people tell me they have trouble folding the laundry, especially the sheets and stuff like that. And so maybe what you need is just to ask for very, very specific help with chores and tasks around the house, and allow people to help you do that as you're healing. So those are just some ideas about the different types of support, the different ways to use your support system, and also the importance of communicating with folks about the best ways that they can support you. I hope that's helpful. Does anybody have any questions?
Any questions for Rebecca? Nope, no questions.
Okay, well, y'all have a wonderful day.
Thank you.